Is it just a senior moment? That frustrating forgetfulness, the momentary confusion, the feeling that your mental sharpness isn't quite what it used to be. For many, especially as we get older, these experiences are often chalked up to the inevitable march of time, simply a part of aging. But what if I told you that for some, the culprit might not be age itself, but something far more common, something potentially lurking right in your medication cabinet? Welcome, my name is Paul, and today we're diving into a crucial topic: how common medications, ones taken by individuals every single day, could be subtly, silently harming your memory and overall cognitive function. This isn't about causing alarm, it's about empowerment. It's about giving you factual information and actionable steps so you can safeguard one of your most precious assets, your mind, and have informed conversations with your healthcare provider. You see, a significant and often overlooked issue is that certain medication side effects, like confusion or memory disturbances, can strikingly resemble the early symptoms of progressive neurological conditions such as dementia. Imagine that. What you or your loved one might fear is the beginning of something irreversible could, in some instances, be a reversible side effect of a prescription or even an over-the-counter drug. This potential for misidentification can lead to delayed or incorrect diagnoses and unnecessary anxiety. Recognizing this mimicry highlights just how vital a thorough medication review becomes whenever cognitive changes are noticed. Adjusting or discontinuing a problematic drug under a doctor's guidance could lead to substantial improvements. Understanding which medications carry these risks and knowing how to effectively communicate your concerns with your doctor are fundamental steps toward protecting your brain health. So, how can a pill affect memory? Our memory relies on intricate chemical signals and neural pathways. Neurotransmitters like acetylcholine play a star role in learning and forming memories, facilitating communication between brain cells. Certain medications can disrupt this delicate chemical balance. Some might slow overall brain activity, while others impair key neurotransmitters. The result? Confusion, forgetfulness, difficulty concentrating. For instance, medications that block acetylcholine directly impede your brain's ability to process and retain information. Now add aging to this mix. Older adults often show increased susceptibility to medication side effects. Why? Our bodies change. Liver and kidney function, crucial for metabolizing drugs, can become less efficient. Medications might linger longer or accumulate to higher concentrations, intensifying their effects on the brain. Furthermore, the aging brain may have less protective cognitive reserve, a diminished capacity to compensate for drug-induced impairment. A dose safe for a 40-year-old might be problematic for a 70-year-old. This underscores why regular medication reviews are vital for older populations. And when we say common drugs, we mean widely used medications, making their potential cognitive impact a public health concern. Many are also available over-the-counter, OTC. This adds complexity because many don't meticulously list every OTC cold medicine or sleep aid for their doctor. This common oversight can lead to incomplete medication histories and overlooked cognitive side effects. Healthcare providers need to ask, and patients need to proactively disclose everything. We're going to explore 5 common drug classes that can harm your memory. But before we dive into them, if you're new here, or if you're passionate about taking control of your health and aging well, make sure you hit that subscribe button and tap the bell icon. That way, you'll never miss out on our latest videos packed with research-backed tips to help you live your best life. And if you find this information helpful as we go, do me a favor and type yes in the comments below. If not, type no. I read every single reply because your feedback helps us create content that truly serves you. So now let's get to it. Remember, the goal is information, leading to conversation with your doctor. Never self-diagnosis or stopping medication on your own. Drug class number 1, anticholinergic medications.
This is a big category. These medications work by blocking acetylcholine, that crucial neurotransmitter indispensable for memory and learning. When these pathways are inhibited, communication between brain cells is impaired, directly impacting cognitive function. The cognitive impact can be significant: confusion, memory disturbance, agitation, even delirium. But it's not just short-term. Alarming research links long-term use to brain atrophy, a wasting away of brain tissue, and an increased risk of dementia, including Alzheimer's. Some studies suggest prolonged use might cause permanent brain changes. You'll find anticholinergic properties in many common drugs, prescription and OTC. Think of certain antihistamines, like Benadryl, and ingredients in Tylenol PM, Advil PM, or Unisom. Also specific antidepressants, amitriptyline, paroxetine, medications for urinary incontinence, oxybutynin, some anti-Parkinsonian drugs, antipsychotics, and muscle relaxants. Statistics show a significant percentage of older adult physician visits result in a prescription for a high-risk anticholinergic. But here's a critical, often missed point: the anticholinergic burden. This is the cumulative effect when you take multiple medications with some anticholinergic properties, even if each drug alone has a low effect. Someone taking an allergy pill, a sleep aid, and an antidepressant, each with some anticholinergic activity, might experience a significant cognitive burden from their combined effect, increasing memory problem and dementia risk. This cumulative load is often overlooked. Healthcare providers must review all medications for their combined anticholinergic impact. Drug class number 2, benzodiazepines. Often known as downers or sedatives, benzodiazepines slow brain and central nervous system activity. They boost GABA, an inhibitory neurotransmitter, essentially putting brakes on your brain. The memory impact includes drowsiness, dizziness, loss of balance, and general mental slowing. Crucially, these drugs interfere with transferring information from short-term to long-term memory. This effect is so pronounced, they're used in anesthesia to induce amnesia. For older adults, benzodiazepine effects are problematic as they last longer due to age-related metabolism changes, increasing risks of prolonged cognitive impairment and falls. More concerning, prolonged use is linked to structural brain changes, potential shrinking of key memory centers like the hippocampus and amygdala. This can significantly increase dementia risk, including Alzheimer's. Some studies suggest a 32% to 84% increased risk, and may reduce brain neuroplasticity, its ability to adapt. These are commonly prescribed for anxiety, insomnia, and muscle spasms, carrying risks of dependence and misuse. Examples are alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan. Their use is widespread. In 2020, about 4.8 million individuals reported misusing them. Older adults, 65 plus, are prone to long-term use, with 91% of their prescriptions being renewals for chronic conditions like insomnia and anxiety. Women are twice as likely to be prescribed them. There's a paradox. Prescribed for short-term relief from anxiety or sleep issues, prolonged use can cause significant, potentially irreversible cognitive damage. This highlights the need for careful consideration of use duration, lowest effective dose, and exploring non-pharmacological alternatives, especially for chronic conditions in older adults.
Drug class number 3, opioids. Opioids primarily relieve pain by interacting with opioid receptors, altering how the brain perceives pain. Cognitive impacts include confusion, drowsiness, and a detrimental effect on short-term memory. Naperidine, one specific opioid, is particularly cautioned against for older adults due to heightened risk of confusion and seizures. Opioids like oxycodone, morphine, and codeine are widely prescribed. In 2023, approximately 125 million opioid prescriptions were dispensed in the U.S. Given their primary purpose of pain management, the focus is often on alleviating discomfort. However, these medications have significant cognitive side effects. The immediate benefit of pain relief can overshadow subtle cognitive impairment, potentially leading to prolonged use without adequate brain health monitoring. Combining opioids with other sedatives like benzodiazepines compounds risks of severe sedation and breathing difficulties. Patients must discuss all side effects, including cognitive ones, with prescribers, and explore non-opioid pain management to minimize cognitive burden. Drug class number 4, anti-seizure medications, including gabapentinoids. These medications dampen signal flow in the central nervous system, slowing the brain down to control seizures or nerve pain. Gabapentinoids like gabapentin, Neurontin, and pregabalin, Lyrica, influence GABA transport and calcium channels, contributing to inhibitory effects. Cognitive impact can manifest as general brain slowing, leading to memory issues, attention problems, and increased sleepiness. Older anti-epileptic drugs, AEDs, often have more pronounced cognitive side effects than newer ones. Phenytoin can cause drowsiness and confusion. Topiramate may lead to memory and speech difficulties. Newer AEDs like levetiracetam or Keppra, levetiracetam or Zonogram generally have a lower incidence of thinking and memory problems. Newer AEDs like Vibastrine or Lamotrine are often considered safer cognitively than older ones like phenobarbital or carbamazepine. Anti-seizure medications treat seizures, nerve pain, bipolar disorder, and mood disorders. Gabapentin prescribing has soared, becoming one of the most commonly prescribed medications. In 2021, 70.9 million gabapentin prescriptions were dispensed in the U.S., much for off-label uses like various pain types and substance use disorders, not just seizures. This rise in gabapentinoid prescriptions, largely for off-label uses, is important for cognitive health. When a drug is used off-label, its cognitive side effects for that use might be less studied or anticipated. This can lead to widespread, unrecognized cognitive impairment. Individuals might not connect memory issues to a medication taken for chronic pain. This underscores discussing all reasons for medication use with providers and vigilance about cognitive side effects, even if the drug isn't primarily for a neurological condition. Drug class number 5, skeletal muscle relaxants. Most skeletal muscle relaxants exert anticholinergic effects, contributing to sedation. Their primary function is relieving muscle spasms. Cognitive impact primarily manifests as drowsiness and weakness. While not always a direct memory impairment, drowsiness and weakness critically increase fall and fracture risk, especially in older adults. Falls, particularly those that cause head injuries, are a known cause of memory issues and cognitive decline. So a medication affecting physical function can have a substantial, indirect, yet severe cognitive impact if it leads to a fall. Skeletal muscle relaxants like cyclobenzaprine, Flexeril, and methocarbamol, Robaxin, are common for localized musculoskeletal pain. About 2 million Americans, including over 300,000 aged 60 plus, are prescribed them. These drugs illustrate interplay between physical side effects and cognitive health. Drowsiness and weakness are forms of cognitive impairment that affect alertness. Their biggest threat to long-term memory might be increased fall risk. A fall can lead to concussion or traumatic brain injury, direct causes of memory problems. When evaluating medications, consider the full spectrum of side effects, including those increasing physical vulnerability due to ripple effects on cognitive health. So, the 5 drug classes, anticholinergics, benzodiazepines, opioids, anti-seizure medications, including gabapentinoids, and skeletal muscle relaxants, each can risk your memory. While medications are significant, memory issues can arise from other treatable conditions. Addressing these can lead to substantial cognitive improvements. For instance, depression isn't just sadness. It can manifest as forgetfulness and mental fogginess, but effective treatment often improves memory. Sleep apnea, where breathing stops during sleep, causes daytime tiredness and forgetfulness. Treating it can enhance alertness and memory. Uncontrolled high blood pressure can exacerbate brain blood vessel changes, contributing to memory loss. A deficiency in vitamin B12, common in older adults, affects memory and neurological function, but is often reversible with supplementation. Hypothyroidism, or an underactive thyroid, can cause forgetfulness, which treatment can resolve. Even a seemingly minor head injury can cause memory issues. Beyond clinical depression, other emotional conditions like stress and anxiety can lead to forgetfulness. Chronic or excessive alcohol consumption severely impairs mental ability and dangerously interacts with medications. And of course, underlying brain diseases like tumors or infections can directly cause memory loss. A thorough evaluation by a healthcare professional is vital for memory changes to differentiate causes. What can you do? Crucial first step: never stop prescribed medication without professional medical advice. Abruptly stopping certain drugs, benzodiazepines, and anticholinergics, can cause severe withdrawal, cholinergic discontinuation syndrome, nausea, dizziness, anxiety, and insomnia, and worsen the original condition. Always consult your provider. A positive development is deprescribing, a formal medically supervised process of stopping or reducing medication. It's a collaborative decision, weighing benefits against harms, especially as health or goals change. It often involves gradual tapering to minimize adverse effects. This proactive approach reduces unnecessary medication burden. It empowers you to initiate conversations about reducing medications, knowing it's a recognized safe strategy. Preparing for that doctor conversation involves several key actions. First, bring a complete list of all your medications. This means everything: prescriptions, over-the-counter drugs, supplements, herbal remedies, and vitamins, along with their dosages and how often you take them. This complete picture helps your doctor spot potential interactions or those cumulative effects we discussed. Second, make some notes about when your symptoms began and what specific tasks are becoming difficult. Providing concrete examples like forgetting common words, misplacing items, or finding familiar tasks take longer offers crucial diagnostic clues. And third, consider bringing a trusted family member or friend to the appointment. They can offer additional observations about cognitive changes you might not have noticed and provide support.
When you speak with your healthcare professional, there are several key questions you should aim to ask. You can start by asking, why am I taking this specific medication? Understanding the reason is fundamental. Then inquire, what are the potential benefits and harms of this medication, especially concerning my memory? It's also important to ask directly, can this medication affect my memory or increase my risk of falls? And very significantly, ask, is it possible to stop or reduce the dose of this medication? Is deprescribing an option for me? Finally, be sure to clarify, who should I follow up with regarding this and when? Your provider may also ask you about recent medication changes, alcohol use, head injuries, and mood. And remember, it's perfectly appropriate for you to inquire if you need to see a specialist like a neurologist or geriatrician. The good news, for many conditions treated by memory-impacting drugs, safer alternatives or non-pharmacological approaches exist.
For allergies or sleep issues, second-generation antihistamines like cetirizine or fexofenadine are generally less sedating than older options. For insomnia, lifestyle changes like a regular sleep